Hey everyone, welcome to this explainer on folic acid. Today, we're going to transform standard pharmacology into a really dynamic, step-by-step patient journey. Whether you're studying for your boards, reviewing clinical guidelines, or just looking to sharpen up your daily practice, you are absolutely in the right place. We're taking that dry, textbook data and bringing it straight to the bedside, breaking down every single thing you need to know about this vital water-soluble vitamin. Here's our roadmap for today. We'll be looking at the basics of folic acid, administration and interactions, side effects and monitoring, essential nursing considerations, and finally, educating your patient. All right, let's jump straight into part one, the basics of folic acid. So let's set the stage here. You can think of folic acid, or vitamin B9, right, as the body's ultimate cell division factory. It is absolutely crucial for erythropoiesis. Basically, that means it directly stimulates the production of red and white blood cells plus platelets. Inside the body, it's required for nucleoprotein synthesis and keeping that normal, healthy blood cell production humming along. Clinically speaking, we rely on it to treat folate deficiency anemias, to prevent neural tube defects during pregnancy, and, of course, to act as a vital dietary supplement for anyone who just needs a boost. Now, when you're looking at patient orders, you're typically going to see medications like Fulvite or maybe just standard nutritional supplements. But here's the catch. Keep a really sharp eye out for leucovorin. This one is a highly specialized, reduced form of folic acid, and it's actively used as a rescue drug to prevent severe toxicity from high doses of methotrexate, which is a folate antagonist. Knowing these specific names for sure ensures you understand the true clinical intent behind every single order you process. You know, it's actually pretty interesting. You'll often find folic acid grouped right next to cardiac and systemic medications in your clinical references. And why is that? Well, it's because a deficiency doesn't just cause a simple anemia. It creates this widespread, cascading systemic effect. We're talking about elevated homocysteine levels, which are directly linked to significant cardiovascular risks. So treating a folate deficiency is truly about protecting the entire systemic health of the patient. It's a real game changer. Moving right along to Section 2, Administration and Interactions. Okay, so before you actually administer the dose, you've got to verify your routes. Folic acid can go oral, subcutaneous, intramuscular, or intravenous. But listen, if you're pushing it IV, hit the brakes for a second. It absolutely must be given slowly. You also really need to protect your parenteral solutions from light, and always double-check your compatibility charts if you're running it alongside other IV fluids. Now, before we move forward, we have to ask a massive question. Who should never take folic acid? The absolute hard stop contraindication here is undiagnosed anemias, particularly pernicious anemia. If you give folate in this scenario, it'll actually correct their blood work, essentially masking the problem, all while severe and irreversible neurological damage silently progresses in the background. You absolutely must have a confirmed diagnosis before you start treatment, no exceptions. So let's talk about what could throw a wrench in our treatment plan. Folic acid can actually decrease the serum levels of anticonvulsants like phenytoin, which obviously risks triggering seizures. On the flip side, drugs like oral contraceptives, alcohol, and barbiturates will impair folate absorption. Oh, and here's a fun dietary fact for you. While things like spinach and beans are packed with naturally occurring folate, the vitamin itself is highly water-soluble and heat-sensitive. So if you extensively boil those vegetables, you'll literally destroy the vitamin before it even makes it to the plate. All right, on to Section 3, Side Effects and Monitoring. Once the medication is in the system, we need to monitor the physiological response. Think of it kind of like a detective hunt. You're hunting for changes in the complete blood count, specifically keeping a close eye on hemoglobin and hematocrit to see if the anemia is actually resolving. A spike in reticulocytes? That's your green light. It proves the bone marrow is actively responding to your therapy. And of course, always monitor serum folate right alongside vitamin B12 levels to make absolutely sure you aren't masking that pernicious anemia we just talked about. You've really got to know how to contrast a minor nuisance against a full-blown emergency here. Because the vitamin is water-soluble, your body just naturally flushes out the excess folic acid. That means standard side effects are super mild, maybe a slightly yellow discoloration of the urine or a rare bit of GI upset. But watch out for incredibly rare allergic hypersensitivity. If your patient starts exhibiting bronchospasm, erythema, or any signs of anaphylaxis, that is a medical emergency, and you must halt administration immediately. Which brings us to Section 4, Essential Nursing Considerations. These right here are your frontline clinical responsibilities. First, assess the patient for baseline fatigue, weakness, and shortness of breath. During the therapy, you need to evaluate their nutritional status and dietary intake, like are they actually eating those folate-rich foods we mentioned? You also need to physically assess for signs of therapeutic response. Are they showing improved energy levels? Are their mucous membranes looking pinker? This is exactly where your critical thinking pieces the hard lab data together with the physical human being sitting right in front of you. And finally, Section 5, educating your patient. As we get ready for discharge, we need to walk the patient through their specific role. First off, tell them to take the medication exactly as directed. No doubling up if they miss a dose, right? Second, guide them to the produce aisle for folate-rich foods like spinach, broccoli, and fortified cereals to really support their therapy. Third, instruct them to report any rash or breathing difficulty instantly. And finally, just give them a heads up that a deeper yellow urine is totally harmless and totally expected. To wrap up our whole clinical workflow today, we have to look back and ask, have we provided everything necessary for this patient to safely self-administer? Because an educated patient is the ultimate goal of any pharmacological intervention. So the next time you see folic acid pop up on a chart, ask yourself, are you just pushing a routine vitamin, or are you literally safeguarding their entire systemic health? Keep exploring, keep learning, and I'll catch you in the next explainer.